Today, we are going to talk about delusions and paranoia and hallucinations as they relate to dementia. And so the goal today is to really just kind of educate you about what they are, why they happen. And I believe that education is a great tool for us to cultivate compassion. And so the better we understand our loved ones, the better we understand the symptoms of their disease, I think the better we'll be able to care for them as we are now equipped to have compassion for them and understand that some of these behaviors, all of these behaviors are not controllable by our loved ones. And so I will go ahead and pull up my PowerPoint now and get started. We're at 10:01, and as people join, they can just catch up with us. So let me share my screen here. You don't want to see my mail. There we go. Let me go ahead and collapse this here. All right, so I do want to also make a note that at the end of the PowerPoint, I will have some resources available for you. So if you want to take some time and grab something to write with, a pen, paper, to just jot some information down that might be helpful for you towards the end of our presentation. And of course, as always, please put your email in the chat box so that I can send you your post survey. That's a great way for me to get feedback about the trainings that we offer, letting me know what's working, what isn't working, so that I can create more applicable trainings for you all as we go. So today, again, we're talking about delusions, paranoia, and hallucinations in dementia patients. And our agenda today is we're going to define our terms, right? What is dementia? What are hallucinations? What are delusions? What is paranoia? And possible causes. Main causes are UTIs, urinary tract infections, and something called confabulation, which I'll define for you as we go through the presentation. And then I'm also going to go through some intervention strategies and how you can take care of yourself while caregiving, and then of those resources that I mentioned earlier. Let's see here. All right, so what is dementia? Dementia is a group of thinking and social symptoms that interfere with daily functioning. Dementia is not a specific disease. A lot of times we hear Alzheimer's and dementia used interchangeably. Not all dementias are Alzheimer's, but Alzheimer is a disease that causes dementia. Okay, so it's a group of conditions characterized by impairment of at least two brain functions, such as memory loss and judgment. Symptoms include forgetfulness, limited social skills, and thinking abilities, so impaired that it interferes with daily functioning. All right, so if you're taking care of a loved one who has dementia, this is just a refresh for you, right? So we're going to talk about hallucinations versus delusions and paranoia. So sometimes we will hear these terms used interchangeably, but they are actually different. So due to changes in the brain, people living with dementia might sometimes experience hallucinations, delusion, and or paranoia. So we might hear the terms delusion and hallucinations used interchangeably, but they're actually different. A hallucination is defined as a false perception of objects or events and is sensory in nature. When individuals living with dementia have hallucinations, they can see things, hear things, smell things, or taste things that aren't even really there. So it's going to affect your five senses. They might see insects crawling on their hand or hear people talking to them, and they might even respond to those voices. In contrast, a delusion is defined as a false idea or belief, sometimes originating in misinterpretation of a situation. So hallucinations affect our five senses, and delusion affects our perception of the world as far as understanding situations. So an example would be if an individual living with dementia has a delusion, they might think that family members are stealing from them, or that maybe the police are following them. And it's called a suspicious delusion, and that's what we refer to as paranoia. Okay, so paranoia is a delusion, but it is suspicious in nature. And delusions are common. That's a common symptom of dementia that usually appears in the middle and late stages of the disease. While some delusions won't disrupt daily life, others can be especially stressful. In particular, paranoid delusions. They can be distressing for the patient and the caregiver, or your loved one and you. So it's important to remember that hallucinations and delusions may or may not be upsetting to the person, right? Not all hallucinations are frightening, and not all delusions are paranoid in nature. Sometimes they may be the result of a person trying to make sense of things. So an example would be the person might not remember putting their purse away and conclude that someone must have stolen it. So both delusions and hallucinations might worsen at night if your loved one suffers from sundowning, okay? So we're gonna get into hallucinations a little bit more. So dementia hallucinations can be relatively harmless or very frightening for your loved one and for you, right? It's kind of hard to see someone that you love having sensory or having delusions, and you don't know how to help them, right? You're trying to tell them this isn't real, that you're okay, and in their mind it is real and they're not okay. So that can be very frightening for someone. And examples of common hallucinations include hearing music or voices, seeing bugs that aren't there, seeing animals or pets or people that aren't there. So caregivers might observe your loved one with dementia talking to themselves as they attempt to interact with what they're hallucinating. Okay. For people with Alzheimer's, hallucinations are common more often in the middle to late stages of the disease. However, they can happen for brief periods at any stage. Experience hallucinations in the early stages, especially visual hallucinations, is more common with dementia patients, especially if you have vascular dementia. Sorry, lost my train of thought. So people with vascular dementia can experience hallucinations. It's one of several symptoms that you might notice, which could also include delusions, depression, apathy, and a lack of willpower. And also experiencing hallucinations in the early stages. Visual hallucinations is common with seniors that have Lewy body dementia. So if you're not sure which dementia your loved one has, I do have a training that I presented about a month ago called The Other Dementias, and it kind of goes through the top 5 most common dementia diagnoses, and it can kind of give you an idea of the differences. And maybe if you haven't spoken with your provider yet and you don't have a specific dementia, you can talk with them if something in that presentation kind of sparks your interest. So next we've got possible causes of dementia, or sorry, of hallucinations. And I'm gonna see if I can change this here. I've got a little bar here that's blocking my notes, so I can't read them. So I'm gonna try to get a little tech difficulties here situated. Okay, so a UTI is the most common cause of a sudden increase in confusion or in confusion in dementia patients. So medical community professionals, they're not really sure why this happens. Why do UTIs cause confusion in older people and dementia patients? But they're kind of theorizing that it's a lower baseline for clear thinking and effective communication that contributes. So if they're not able to tell you what's wrong, they're not able to tell you what hurts, and it can be very disorienting for everybody. So that they're saying it's kind of like the underlying cause. A UTI is an infection of the urinary tract. So it's most commonly in the bladder. And so for most people, the key symptoms of UTI include the need to urinate frequently or urgently, a burning sensation while urinating, and urine with an unusual color or odor. So sometimes there's also a little bit of blood in the urine, but these symptoms are often missing in older adults, or they're unable to articulate them. So instead, a senior may suffer from unexplained incontinence, fatigue, or sudden changes in their behavior and mental status. So what causes a UTI? In younger people, they're usually related to frequent sexual activity, but in older folks, it's changes in personal hygiene that's often the factor. So that can be due to cognitive decline or physical limitations caused by conditions like arthritis, COPD, or a stroke. Functional limitations can make it difficult for a senior to manage incontinence care and keep themselves clean, especially after toileting. And so, maybe mom went to the bathroom, everything seemed to be okay, everything was fine, but maybe she wasn't able to clean herself properly, and that led to an infection that crept up into the urinary tract. And so that's why I think it's more common in the elderly, because of those maybe physical limitations that they might have. Family caregivers, you all play an important role in recognizing new health issues in your loved ones, right? Because you're there 24/7. You know everything that's going on with them. So be on the lookout for these classic and more unusual UTI symptoms. So there's physical symptoms I'm going to go through, and then I'm going to go through psychological symptoms. So the physical symptoms could be the need to go to the bathroom frequently or urgently, complaints of discomfort while urinating, pain in the lower abdominal area, frequently touching yourself in that area, cloudy, dark, or foul-smelling urine, new or worsening incontinence, and of course, fever and chills because it is an infection. And the main effect of a UTI on a senior's mental health is delirium. So the US Library of Medicine defines delirium as a mental state in which a person is confused, disoriented, and unable to think or remember clearly. The following symptoms of delirium are commonly seen in older adults with UTIs. However, they might not all be present, and they may fluctuate over time. So keep an eye out for these symptoms. But again, keep in mind that you might not see all of them, or you might see some of them kind of peeking through here and there and fluctuating. So any sudden change in a mental status is a red flag, right? It could be a UTI symptom, and it could be something else. So if you notice your loved one having any sudden change in their mental status, that's something to kind of keep an eye on. Confusion, memory loss, trouble concentrating, lethargy, so just not being able to be awake, and just kind of like fatigue. Of course, hallucinations and delusions, restlessness or agitation, violent behavior or yelling, and changing in levels of consciousness. And so if you have difficulty waking a senior, that's considered a medical emergency, okay? So even if they don't have any of these other symptoms, if your loved one is having a difficult time staying conscious, you need to contact 911, call the emergency line as quickly as you can. So now we're going to talk about delusions. So delusions tend to affect multiple aspects of a dementia patient's behavior across a variety of situations. So no one delusion is going to look the same, okay? And delusions in one person are going to be different than delusions in another person. Paranoia or suspicious delusions are particularly distressing for everyone involved. They're pervasive false belief that typically cause seniors living with dementia to believe they're being followed, imprisoned, stolen from, neglected, wronged, or victimized, often by the one closest to them. So oftentimes caregivers are being accused of a lot of these negative behaviors that aren't happening, but because of the delusion, your loved one believes what they're saying, okay? So delusions among dementia patients are typically the result of their cognitive impairment, right? So we have to remember that our loved ones are not who they used to be. And so the delusions that come up that are maybe paranoid in nature, that are accusing you of things, it's hard to take that with a grain of salt, right? Because it's very hurtful, especially if you are taking care of your loved one as best as you can, and you would never do anything to hurt them. So I think it's good for us to remember when these things come up that we can't take them personally. Okay, this is the disease talking. So delusions can occur when a senior tries to make sense of a situation, but their confusion and memory problems make it impossible. So they end up filling a hole in a faulty memory with a delusion that makes sense to them. So their brain is always going to try to connect the dots with the information it's receiving. So if you can't find, like we said before, if your loved one loses their purse and then they think, well, somebody must have stolen it because they forgot where they put it, that is a phenomenon called confabulation, and we'll talk about that next. So examples of delusions in a person with dementia include a belief that an imposter has replaced their relative. That's actually known as Capgras. I think I'm pronouncing that right. Capgras or Capgras syndrome. So it's very common. Fear that their home is being monitored or invaded by intruders. Suspicion that someone has stolen their valuables. They may insist that their spouse is cheating on them. That's a very common one. A firm belief that they're younger than they actually are, and feeling that they need to go home when they're already home. And so even just having conversations with caregivers That seems to be one of the more common ones that I hear people talk about, where their mom or their spouse or their dad is, I want to go home. It's time to go home. And that could be just because, maybe you reorganized your living room, or maybe you got some new furniture, or you redecorated and it doesn't look the same to them anymore. And so they conclude that they're not home. Okay. Because their brain cannot connect the dots in the way that yours or myself can. Okay. So now we're going to talk about confabulation. So we know that dementia is a neurodegenerative process that happens, right? So it's a breaking down of the neural networks in the brain. And so this has pronounced effects on behavior, emotions, and ability to think rationally. So even as the brain incurs damage, it'll still struggle to make sense of the information and the stimuli it receives. And it works around lapses in memory and cognitive ability. So if you think about it, their brain is still working as best as it can, right? Because that's what all of our brains do. We receive stimuli, we receive information, we, make sense of it, we draw conclusions, and we go out into the world operating off those conclusions. It is the same for a person with dementia, okay? It's just that their puzzle's missing a couple pieces, right? So they're not seeing the full picture. Hopefully that makes sense. So many dementia patients will rely on confabulation to fill the gaps in their memories, especially when compensating for memory loss in the early stages of the disease, right? So what is confabulation? Confabulations are related to memory recall. So the brain incurs damage, it still struggles to make sense of the information and stimuli it receives and to work around lapses in memory and cognitive ability. Many dementia patients rely on confabulation to fill in gaps in their memory, especially when compensating for memory loss in the early stages of the disease, like I just said. Confabulation is the creation of false memories in the absence of intentions of deception. So what that means is you may not be intending to deceive somebody, but their ability to make sense of the information they're getting is limited, and so they are drawing conclusions. So individuals who confabulate have no recognition that the information being relayed to others is fabricated. So if they say you stole my purse, they believe you stole their purse. Okay, they have no idea that the information that they're speaking is fabricated. Okay, they believe it. So this can make you think too, do dementia patients lie? Okay, so when a person develops any form of dementia, it is difficult for family and friends to witness their diminishing capacity and the unbearable frustration it brings, right? Especially if you're looking back and you're thinking, this isn't who I married, this isn't mom, this isn't dad, because they are different. Their brains are structurally different, so their behaviors are going to be different. So one of the worst things dementia caregivers must cope with is the fact that a loved one's brain is broken, and it may cause them to tell terrible quote unquote lies about you. Neurological damage can cause patients to make up hurtful stories and level false accusations towards your caregivers. And no matter how far-fetched the untruths and accusations might be, a dementia patient believes these things are truth. So as much as these untruths might hurt, it's important to remember that there's no ill intent. The disease is causing your loved one to fabricate stories. Okay, so again, when I said at the beginning of the presentation that education is a great tool for cultivating compassion, this is what I'm talking about, okay? So they're not lying to you, they're not lying about you, they're not trying to hurt you, they're just living in their perception of the world, okay? And there's nothing that you can do or that they can do to control that. So emotions like anger, anxiety, and confusion often leave elders feeling vulnerable and taken advantage of, which can cause them to become defensive and accusatory as they try to make sense of what they cannot understand or remember. So misplacing and hiding personal items is a hallmark of dementia, and it can be terribly disorienting and frustrating for them and for you. So when you add a bit of paranoia and delusional thinking, a quote unquote lost purse or medication bottle can suddenly spur a senior into falsely accuse their family caregiver of theft. I do want to make a note though, that there are people who take advantage of the elderly, and they do financial abuse and they steal from them, okay? So not every accusation is a delusion or paranoia. or confabulation, okay? So not to say that anyone here specifically is doing those things, but we also have to give our seniors a benefit of the doubt here. So if they insist that something's been stolen, it is worth the investigation, okay? Especially if they're accusing somebody, that isn't you, because you didn't steal nothing, you know the truth, right? But if they're saying somebody else maybe has come in and taken something or what have you, we always want to investigate and rule out accusations because they do happen, okay? Things do end up missing, people do get abused, so we don't want to say it's all delusions, okay? So that's going to bring us to our next topic, which is dementia, delusions, and false accusations of elder abuse. So most false accusations stem from their inability to connect with reality. So an example would be assistance in bathing or dressing may be misconstrued as inappropriate touching, because again, they're trying to fill in the facts, okay? Trying to get an elder into the car to go to an outing or a doctor's appointment could translate to kidnapping, right? Because they're not fully getting all the information in line like you or I would. The way that they perceive the world around them has changed, and their reaction is often one of fear, suspicion, and self-protection. Okay, so remember that. They're afraid, they're trying to protect themselves, okay? They're not trying to be ugly to you, they're not trying to be mean, okay? They are just working off of their perception, okay? So when it comes to making up stories, dementia patients are not intentionally causing trouble. So unless an elderly loved one has a history of compulsive lying, it's likely that their fabricated stories are purely a product of their cognitive decline, okay? So we also have to keep in mind, there are people who maybe haven't always been honest, right? Who maybe do make up stories, who maybe do fabricate accusations. When they had a healthy mind, this is who they were. So you always have to take in consideration the individual and who they are, their personality traits. But if this is out of the ordinary for them, or if it's gotten worse as the disease has progressed, keep in mind it could be a delusion or a hallucination or paranoia that is the result of their declining neuro abilities, okay? So keep in mind that accusations are often transient, and they will usually forget or eventually forget the incidents that they initially reacted to. So it's hard for you to forget that you were accused of stealing or kidnapping or hurting somebody that you love. But this is also a time to remember that your loved one is sick, okay? So they might get over it right away, totally forget that they just slandered you the way that they did. And here you are still wounded. Here you are still licking your wounds and feeling bad because you didn't forget, right? So keep that in mind. Give yourself some grace, give yourself some time to process, and try to remind yourself that this is the disease, this isn't your loved one, okay? So what are some good intervention strategies? So caregivers will commonly struggle to adapt to their family members' physical, cognitive, and emotional changes, right? So even after you've learned about proper ways to respond to dementia, hallucinations, and delusions, it could still take plenty of patience and practice. Repeatedly stepping into a loved one's alternate reality is exhausting, right? So recognizing the causes of these dementia-related behaviors and understanding what a loved one goes through while enduring a hallucination and a delusion may help you to remain calm and find solutions. So witnessing a hallucination or delusion for caregivers is probably one of the more disturbing symptoms of the disease. And so I think it's important that you really have a handle or an understanding of some of these behaviors so that you are able to process through them personally and then also assist your loved ones so that they are not afraid and they are calmed down and they know that they're safe. So when do we see the doctor? Okay, so helping someone who is experiencing hallucinations or delusions, the best way to start is arranging a consultation with your doctor or with their doctor. So the physician will look for any physical causes, so kidney bladder infections, dehydration, pain or alcohol, and drug abuse, which is common in seniors. And all of those can cause hallucinations or delusions. So we want to go to the doctor and rule any of that stuff out. And it could also be possible that treatments being prescribed for pain are the cause. So sometimes people react poorly to medications, and you don't know until you go to the doctor and tell them the symptoms, and they say, "Oh, right, I know what you're talking about. I know what this is." So if the physician prescribes a medication, watch for and report any side effects that you notice, including oversedation. So if they seem out of it, not awake fully, that could be an indicator that they're not responding well to the medication. Increased confusion, tremors, or tics. So these can be signs that they're not responding well to the medication. And it could also be helpful to have the person's eyesight or their hearing checked. This should be done regularly. And make sure that if they have any prescribed glasses or hearing aids, that they use those as well. Because again, hallucinations, like remember, they affect our senses. So if we have weakened sight or poor hearing, then our brains are going to be even more working even more hard to try to make sense of the information that's coming to you. If it's garbled or if it's out of focus, it's going to be a lot more difficult for that. So make sure they're wearing their glasses and their hearing aids. There are non-medical interventions that we can take. So, and they're often the best ways to help someone experiencing hallucination or delusions. So not everything needs a pill or a shot thrown at it, right? So we can assess the situation and determine whether or not the symptom is a problem for you or for the individual, okay? So when we say assess, we ask these questions. Is the hallucination or the delusion upsetting to the person? Is it leading them to do something dangerous? Does the sight of an unfamiliar face cause them to become frightened? If so, react calmly and quickly with reassuring words and comforting touch, okay? Sometimes people will see things that they enjoy, right? Sometimes they hear music playing, or they see, you know, a cat on the couch, or maybe there's, you know, a small child that's coming to visit them, okay? You can assess, are they happy? Are they enjoying themselves? Are they scared? If it's not bothering them and they seem to be, you know, happy about the delusion or the hallucination, you know, if they're getting something positive from it, you can just ignore it. It's not going to hurt them and it's not going to hurt you, okay? But caring for someone with dementia who's having a delusion or a hallucination, we don't want to try to convince them that it's not real, okay? So that might lead to anger or aggressive behavior. If you try to say, Mom, there's no cat on the couch, and she says, yes, there is, I'm looking at it right now. No, there isn't, Mom, okay? That's just going to start a snowball effect of back and forth, and you're both going to be frustrated and you're both going to be angry. So if Mom says there's a cat on the couch and she seems happy that there's a cat on the couch, you can just say, what a cute cat, Mom, and that's the end of it, right? It doesn't have to be an argument. You don't have to try to convince them it's real or it's not real, because to them it is. So it's always good to be reassuring and comforting, especially if they seem to be upset by the hallucination or the delusion. Okay. So assessing the situation. How is the person responding to the hallucination or the delusion? I think I got ahead of myself there, so I'm repeating it. If they don't cause problems to the person, it's typically best to ignore it. And it avoids arguing with your loved one about what they see, hear, or believe. So it's natural to want to correct a person, but unless the behavior becomes dangerous, you don't need to intervene. Next, offer reassurance. Reassure the person with kind words and gentle touch. For example, you might want to say, don't worry, I'm here, I'll protect you, I'll take care of you, or I know you're worried, right? Would you like me to hold your hand and walk with you for a while? So that kind of stuff could turn the person's attention towards you and reduce the symptom, okay? Especially if they're seeing something that's troubling them. Also look for reasons or feelings behind the hallucination or the delusion and try to find out what it means to them. So an example would be, you might want to respond with, it sounds as if you're worried, or I know this is frightening for you. And really what you're doing is you're validating what they're experiencing, okay? You might not see a cat on the couch. That's okay. They do, okay? So again, you're kind of implanting yourself into their perception and reassuring them and making them feel safe, okay? If we try to combat the hallucination with our reality, we're gonna miss the mark completely. Another tip would be distraction or redirection. So redirection is a strategy that you can use, but it might not work for everybody or every false belief. If a loved one is experiencing a mild delusion, offering a favorite snack or an activity might be enough to shift their attention. Suggest they come with you on a walk or sit next to you in another room. So sometimes being by themselves can cause a lot more fear than if they know that someone that cares about them is next to them. Frightening hallucinations and delusions will often subside in well-lit areas where other people are present. You might also try to turn their attention to a favorite activity, such as listening to music, drawing, looking at a photo album, or counting coins, okay? So you can think too, if your sight is poor and you're in a dark room and you're experiencing mental decline because of your dementia, you can imagine how easy it would be to, misinterpret a shadow in the hallway, or, see a face in the window when it's maybe just a smudge. Okay. So again, you have to remember these are sensory experiences. So if we shift the sensory input in the room by bringing in lights and bringing other people into the space, it's going to be easier for them to have those markers to make sense of their reality, because now they see more clearly, or they hear more clearly, or they know they're not by themselves. Okay. Next, respond honestly. So someone may ask you about the hallucination or the delusion. So they might ask you if you see him, right? They're saying somebody, do you see him? And you may want to answer with, I know that you see something, but I don't see it. Okay, that's being honest without being combative. You're not denying what they see or hear, but you avoid getting involved in an argument. And this response also helps to normalize the person's experience. Okay, so depending on your loved one's stage and their ability, their cognitive ability, they might be able to understand, oh, this is a symptom of dementia or something like that. Okay, but we don't want to ignore them, or say, well, that's not real, you're acting crazy, or anything like that. Okay, we want to be kind, but be honest. Next, you can modify the environment, like we kind of briefly touched on before. Removing triggers or removing the person from a triggering environment may help reduce hallucinations. So triggers could include lighting that casts shadows, sounds that could be misinterpreted, such as the TV, or mirrors that might cause them to think they're seeing a stranger instead of their own reflection. So if a person looks in the kitchen curtains and sees a face, you may be able to remove, change, or close the curtains. You don't have to say, oh, there's no face there, sit down. Okay, just simply remove the triggers, modify the environment. Okay, turn on more lights to reduce shadows that could look frightening. And if a person has delusions about people stealing from them, have duplicates of those items on hand so you can provide them with a replacement if it becomes lost. So if they say somebody stole my glasses, maybe they just lost them, misplaced them. Oh, I have an extra set. Here you go. Okay, that way you diffuse the situation. Everyone's happy. And finally, intervention strategies can include medication. So non-drug interventions are often effective, but medications can be helpful in some cases when they're persistently upset by symptoms and non-drug approaches have already been tried. Okay, so if everything you've tried is still not working and your loved one is not having pleasant hallucinations or pleasant delusions and they're really upset by it, there are medications available. Okay, so you might want to go and see your doctor, or see their doctor, to help you evaluate them and determine if medication needs to be added, adjusted, or reduced, okay, to combat the hallucinations or the delusions. If they have a history of a serious mental illness, such as schizophrenia, the hallucination
You froze up on my end.
It's froze on my end too. This is Charlotte.
All right, can y'all hear me now?
Yes,
I'm so
I
sorry.
can.
I was just going on and then all of a sudden Zoom was like recording started. And I was like, what? I thought I was already recording. So how do y'all have y'all heard this slide? I'm not sure where it all went wrong.
Yeah, I think we got that slide there.
Okay, okay. So I'll just go with this next paragraph here. So we don't take delusions personally. I think this is one of the best caregiver tips I can give you when it comes to this topic, because it is so difficult when people that we love and care about um, accuse us of things, right? Or say that we're not giving them our all or giving them our best, because we know we are, right? And so try not to take delusions personally. So they can be frightening for the person living with dementia, but they can also be very hurtful when caregivers themselves are the targets. Recognizing that your loved one is living in a world that doesn't make sense to them and that they're probably scared. Okay, so that's where our compassion will come in. We
You froze again. Frozen again.
I think my internet might be squirrely today, guys. I'm so sorry that it keeps falling on me like this, but I'm almost done. So hopefully this will be our last our last reboot. Okay. All right, let's just keep going. Okay. So here's some self-care tips. So coping with emotions and stress. Caring for a person with dementia takes a lot of time and a lot of effort. Your job can become even harder when your loved one gets angry with you, hurts your feelings, forgets who you are, right? And sometimes you could feel discouraged, sad, lonely, frustrated, confused, angry, right? These are all normal feelings. Anytime we see somebody we love struggling, or if they're um, experiencing something that you can't really fix for them, or if, again, if they're accusing you of things that you never even dream of doing, it can be really easy to feel frustrated, angry, sad. Okay, so those are normal feelings. Um, so here's some things that you can say to yourself that might help you feel better if you've got a loved one who's accusing you of things that you've never done. I'm doing the best I can. What I'm doing would be hard for anyone. I'm not perfect, and that's okay. I can't control some things that happen. Sometimes I just need to do what works for right now. I think that's a great tip. I'll enjoy the moments when we can be together in peace. And even when I do everything I can think of, my loved one with dementia will still have problem behaviors because of the illness, not because of what I do. Okay. Again, these behaviors are not about the level of care you're providing. It's about their perception of the world. Okay. And I will try to get help from a counselor if caregiving becomes too much for me. So that's a good point I want to bring up here too as well. Getting professional help, because this is a hard job. It's not easy. And as soon as you feel like you got something down pat, it shifts and changes on you, right? And so you're back to square one, having to relearn the dance. And so getting professional help with a mental health provider or a social work, that can be very helpful, because it can help you with any kind of stress you might be feeling. They can help you understand your feelings better, such as anger and sadness, feeling out of control. Okay. And sometimes we just need someone to validate our experience for us. That can be so healing. And they can also help you make plans for unexpected or sudden events. So one of the programs that we offer to our caregivers, which I'm sure some of you are familiar with it, but if you aren't, it's going to be good information, is a caregiver wellness initiative. And so what that is it is a program, if you're on our reimbursement program already, and you can apply for this, it'll give you 3 free sessions with a mental health care provider that you choose. And they can help you work through some of the things you're experiencing, kind of hold your hand through some of this stuff. And after 3 sessions, if you and your provider think that you would benefit from more, we will give you an additional 3. So within a 12-month calendar year, you can have 6 free sessions from mental health provider. And that could be enough just to get you over a hump if you're experiencing something very difficult, okay? So don't ever shy away from getting professional help, okay? It can always be a benefit to you. Some more self-care tips to keep in mind as you take care of yourself. Understand that you may feel powerless and hopeless about what's happening to the person that you care for. That's normal, okay? Because sometimes you are powerless, right? You can't control how they perceive the world. Understand that you may feel a sense of loss and sadness. That's normal as well. It's a very special category of grief, right? Because it does kind of, you are watching these things in stages, and so it can be like a prolonged grief. And that can make you feel, just kind of in that sadness all the time. Let yourself feel day-to-day uplifts. So that could include good feelings about the loved one that you're caring for, support from other people, or time spent on your own interests. So this is a good way to remind you to redirect your thought patterns. So don't focus on all the things that can't be done. Maybe focus in on the good things that are going on in your life. Okay. Sounds corny, but it really does make a difference. So now I'm going to give you some resources. So if you have something to write with, now's the time to break it out. I'll leave these slides up a little bit so that you can write them down. And a lot of these can be available if you just do a quick Google search. And if you want, I can send you these slides as well to give you that information. If you don't want to write it down, just let me know. So we've got the NIA Alzheimer's and Related Dementias Education and Referral. That acronym is ADIR. And that is a center that offers information and free publications about Alzheimer's and related dementia for families, caregivers, and health professionals. So it's a great way to get some education that's free. ADIR Center staff answer telephone, email, and written requests and make referral to local and national resources. So that could be a good phone number to call, an email to send, or a website to visit and just see what opportunities they have for you there to help. Of course, there's alzheimers.gov. It does talk about Alzheimer's specifically, but there are a lot of other dementia type resources on there. So your loved one doesn't have to have an Alzheimer's diagnosis for you to get the benefit of this website. So there's information and resources on Alzheimer's and related dementias from across the federal government. And a lot of the information I got for you today, I got from that website as well. And then I'll go to the next slide if you guys are done writing everything down. Family Caregiver Alliance, they have a lot of information on their website. If you haven't heard of them, I highly recommend that you seek them out. There's a 1-800 number here as well as an email. So if you don't want to do a Google search, you just want to talk with somebody, call the phone number. If you just want to email them and ask for information, they'll email it to you. Or if you are someone who likes to search on your own, there's the website at caregiver.org, and you can kind of tinker around on there and see what strikes your fancy. Next, we have an elder care locator. Okay, so this could be, I think the last 3 here, Elder Care Locator, National Alliance for Caregiving, and the National Respite Locator Service. These are all resources for you to call them, email them, tell them where you are, tell them what you need, and then they'll be able to give you resources that are applicable to you, okay? And these kind of resources I think are great because it gives you at least a starting point, right? So you're not just out there in the ether trying to get resources, okay? So this is a good starting point for you if you feel like you need some more support. And I'll just leave this up for a little bit if you need to write anything down. All right, and my final resource slide, which I think this is great for everybody to write down. The 24/7 helpline, it's free and confidential, and you can call them anytime to receive reliable information, advice, and support. I think this is great because sometimes you just need somebody to talk to that understands where you're coming from, that understands the diagnoses. There's crisis lines all across the country for all sorts of things, but this is specific to Alzheimer's and dementia, because not everybody is equipped to answer questions or to give you guidance and support unless they've experienced it themselves or have had some training. And so the people on there have done so. So it says that they are trained and knowledgeable staff, and they're ready to listen and can help you with referrals to local community programs and services, dementia-related education, crisis assistance, and emotional support. So the consultations are provided by master's levels clinicians. Okay, so they're not just random people that volunteered, which nothing against random volunteers, but when you're talking about diagnosis specific support, it does help to have somebody who has the education. And it says that they also provide help in preferred language. So if English isn't your first language, or they have interpretive services. And then they also, if you dial 711, you can be connected with a TRS operator, and that's someone that can help you with hearing or speech disabilities to use the telephone. So if you have difficulties with hearing or speech, you can call 711 and you'll get an operator that can help you get those resources. So that's my information for today. I'll go ahead and stop my share, and hopefully you all got it. With all the bumps in the road with the connection, I apologize for that. Technology is the gift that keeps on giving, right? So we've got some time for questions or comments. So I want to open that up for anybody, whether it's in the chat or you just want to unmute and have that question asked, or comments, or if you just want to offer support. There are a lot of people taking care of loved ones with dementia who maybe have experienced some of these symptoms. And so while you all are thinking, brainstorming, if you haven't put your name and your email in the chat, or if you haven't, it disappeared because, you know, technology, please put your email address in the chat so I can make sure I have that for you. So yeah, any questions?
Jenny, this is Charlotte. I would just like to say this was such an eye-opening presentation, even though I have gone through dementia and Alzheimer's before, but you really hit on some high points and you did an excellent presentation. And I really do appreciate that.
Thank you so much, Charlotte. It makes me feel really good to hear your feedback. I like to, you know, tailor this education to people that can use it. And so it makes me happy that you feel that you can use it. So thank you for that.
Thank you.
So I also learned a lot putting together this presentation. And so it's always a good opportunity for me to have these tools in my tool belt as well. If you like presentations like this that give you more of an understanding, a base understanding of diagnoses, please let me know and I'll continue to do that. I've got a list here of all the different diagnoses of our families that are on our program. And so I'm going to kind of start whittling through those and get as much information to you all as you can. But again, I think the more we know, the easier it is to redirect, to respond, to show compassion. And so that's really my goal here, is to make sure that you are got what you need so that you can care for your loved ones better than, well, maybe not better, but you know, more confidently. There we go. And Diane says, thank you for this, and information we can get out to people, the better they will be. I agree with you. Thank you so much for that comment. So I'll go ahead and close it out now unless anybody has any questions or comments. We're about 10 minutes till our closing date, but I don't want anyone to feel rushed off. If anybody just has anything that they want to talk about, I'm also here for you, whether you want to do it now or if you want to call me or email me to schedule a care chat. I'm always there for you to vent if you need support. Okay, so those are also options for you. You're welcome, Alice. Thank you. All right. Well, thankfully our weather's warming up. Hopefully no one's still stuck in the ice. But please do not hesitate to reach out to me if you need to. I do have some trainings coming down the pipeline for everybody. The next one we're going to do is I'm going to continue on the crash course series that I've been doing, and we're going to talk about epilepsy on Friday, and then autism on Tuesday of next week. So I hope you all can join me for that. If they apply to you, I hope you get some good information, spread the word. Please don't forget to sign up so that we can get you that link out. And if there's nothing else, I'll go ahead and close it up for everyone. And I hope you all have a wonderful week. All right. Bye, everyone.